What is the history of ICL development for vision correction? Imagine a tiny lens inside your eye that can help you see clearly without glasses or contact lenses. The development of implantable Collamer lenses, or ICLs, has a fascinating history that spans several decades. It all started in the mid-1980s when scientists and surgeons began exploring ways to correct vision by placing lenses inside the eye rather than removing or reshaping the cornea. This approach builds on earlier work from the late 1940s, when Dr. Harold Ridley performed the first intraocular lens implantation using a material called polymethyl methacrylate. He was inspired by observations during World War II, when plastic fragments from aircraft canopies did not cause rejection or inflammation in the eye. This discovery paved the way for the widespread use of intraocular lenses in cataract surgery by the 1980s. Building on this foundation, the specific development of ICLs started in 1986 when Professor Fyodorov introduced a collar stud-style posterior chamber intraocular lens. This design was the prototype for what would become the modern ICL. The material used for these lenses, called Collamer, is a special biocompatible polymer made from methyl methacrylate and porcine collagen. This unique material offers excellent optical clarity and tissue compatibility, making it ideal for long-term implantation inside the eye. The first clinical applications and research on ICLs appeared in the mid-1990s, marking a new era of innovation. Over time, the lenses underwent several upgrades, from the initial versions to the latest models. These improvements focused on enhancing the lens structure, supporting arms called haptics, and the space between the lens and the natural lens, known as vault. Later models, like the V for degrees Celsius, introduced a central port called central flow, which allows natural fluid movement inside the eye. This design reduces the risk of complications and eliminates the need for preoperative procedures like iridotomies. The V5 model increased the optical zone size to improve visual quality further. Toric ICLs were developed to correct astigmatism, which causes blurred vision due to irregular cornea shape. These lenses have different curvatures on vertical and horizontal axes and include markings for precise placement during surgery. This advancement expanded the use of ICLs beyond simple nearsightedness to more complex refractive errors. The latest generation, the EVO ICL, was introduced globally in 2011 and received approval from the U.S. Food and Drug Administration in 2022. It incorporates all these technological improvements, offering a safe, effective, and predictable way to correct myopia and astigmatism. Over 2 million ICLs have been implanted worldwide, making them a popular alternative to laser procedures, especially for patients with high prescriptions or thin corneas. From an eye health perspective, ICLs provide a way to improve vision without removing corneal tissue, which can help preserve eye health and reduce some risks associated with laser surgeries. However, like any intraocular procedure, careful patient selection and ongoing monitoring are essential to avoid issues such as increased eye pressure or cataracts, which are important considerations for those with glaucoma or other conditions. In summary, the journey of ICL development reflects a progression from early intraocular lens experiments to sophisticated, biocompatible lenses designed specifically for vision correction. Today's lenses combine safety, effectiveness, and versatility, offering a valuable option for many people seeking clearer vision. Always consult with an eye care professional to see if this technology is right for your individual needs.